That's a good thing.
Yeah, wasn't that wild? Those days were wild. Yeah, like what was that from the health department perspective? What was that like for you? Was it crazy?
It was insane.
Yeah.
Like absolutely insane. Like things that you can't ever. It's one of those experiences that like you can't really explain it in words. And during it was a little hard to even just like get people, like we wanted people to understand like the stance where we were. It was obviously very controversial. There was a lot happening, but I was like, yeah, you can't experience it unless you've been through it.
Yeah.
You know, it's kind of like telling somebody who's never had a kid what it's like to have a kid.
Yep.
Like, absolutely. You can't do it until you experience it.
Yeah, you can't put it into words. And this is all off the record, by the way. Like that's the thing too, is the general public did not really recognize is like this is a first go around for everybody. So and like literally day by day, like you're trying to help people as fast as you can, based on the information that you have, which is zero. You know, so everybody's just kind of guessing, and everybody's trying to do their best, and yeah,
and you found yourself like in the middle a lot. So, and then as things sort of get more divisive, like the longer the pandemic drew on, the more divisiveness. And I was like, I felt like we were in this, you know, everything's sort of that bell curve, right? And it was like, you know, there was both sides that were just pressing on the middle. And I was like, we're in this like crazy time, and we're trying to navigate that without information. It was really tough, really tough.
Well, you guys did a good job.
Thanks. Yeah, we definitely we fared a lot better than many other communities. I mean, my counterparts afterwards, there was a lot of, well, like 80% of health officers across the state of Michigan are new post-pandemic.
Oh, damn.
Yeah.
I believe that. Like, yep, I'm done.
Yes.
A lot of teachers did the same thing. A lot of my former teachers were like, yeah, I'm supposed to have like 4 more years until I retire, but like this is not it for me anymore. I'm out, you know, especially like going remote and doing all of that stuff. And and they're older, so they're 63 years old, going like, now you have to teach choir on Zoom. Like, no, I am just gonna sit in my house. Thanks.
Yeah. Like, I don't think this is what I signed up for. So a lot. And some of them, like, they were like, we have no trust. Our relationships are all broken.
Yeah.
And the cool thing about Saginaw is we were the complete opposite.
Really?
Complete opposite.
In what way?
So we had like, so if you talk to any, you know, like health system partners and like our partners in Be Well, they're all like the sense of collaboration that came out of the pandemic. And I think it was the lens that we chose to just look through the problems with. Wasn't about like, right, like just as you said, like we're all in this together and we're trying to figure it out. And are we all making everything right decisions all the time? No. But we're doing the best that we can. And I think it was just like the right people at the right time that sort of understood that and had a little bit of grace. Like we gave each other grace. And then we realized like when we work together, like stuff happens in a much better way than when we're all trying to be in our silos. And it wasn't easy. Like there was some things, you know, hard conversations that happened of like, you know, this isn't a good partnership, or do you realize what you just did here? And so people were like, whoa, okay. We all need to be sort of lock and step with one another. And because of that, I think there was incredible collaboration, and like the value of each of the organizations was built. And they were like, all right, health department, like, what are we doing next? And so that's how we, you know, got Be Well.
So much has to be said about like entering into communication with humility. Like as soon as you establish it, like I am the expert and I am right and you are wrong and I am smarter and you are not, like now you have to try to, like that's a bar that you set for yourself. Now you have to be right all of the time. Whereas like whether it's public communication or personal communication, whether if you enter like we're all just kind of trying our best, and chances are we're going to get things wrong, and then we're going to figure it out and we're going to do better, and then we're going to do that again, and I need you on my team. And now it's like, oh, okay. That's possible. So Be Well was a product of the pandemic.
It was.
Wow.
Yeah, it really was. So it was early 2022, and we were kind of like, okay, the pandemic's coming down, right? Numbers are down. We're not reporting. We're not doing all the same things. Vaccination efforts have been, we're kind of getting to this sense of normalcy. And it was like, we did some really cool stuff, and we have to continue to do that. Like that's why I think the lens of public health was like, wait a minute, you can't just like, as much as everyone wanted to like sit back and chill. So I was on a call with like all the other health departments and the state health department. I think it was the chief medical executive was like, we really want to know like what's going on in communities right now. Like, what is the pulse? What's everybody saying? And what are you guys doing? And a lot of them were like, we just need to take a second, like, which we all did.
Yeah.
Like, totally. I was like, we just need to like step back. We want to get back to like normal service delivery. I mean, like we hadn't provided services in that entire time because my entire staff was like focused on COVID 100% of the time. Yeah. So a lot of health departments just wanted to get back to normal. And I was like, no, there's a new normal now. And it means we have to keep pressing all the issues, because COVID was bad, but we all like, this is where the collaboration, like if we truly want to move health outcomes, we're truly trying to make our communities healthier. Like we all have to be all in. Like businesses, schools, healthcare. It's not just a healthcare problem. Like it's an everybody problem.
I think that's such an important observation that you made, because when you start to feel that collaboration and you see the potential for benefits beyond the immediate need, like okay, it looks like we're coming out of this pandemic, but look at this group of people that are now collaborating, all of these important partners in Saginaw County Health. And if you let off the gas pedal because you're like, hey guys, this has been really great, it's also been really intense, let's reconvene this group in 12 months to talk about how we're going to work. Like, that it's not going to happen.
Right.
Like that gap gets filled with all of the other million things that you're going to do. And then it turns into, oh man, we should have kept that going, and everybody loses. So I think that's such an important aspect to that.
Yeah. And it was hard. I mean, we were all tired, but we were like, we have to keep doing it. And now it's just moving to something else. And so like it kept like, we need to be, reliable, responsible, and responsive. So like, what are the community's needs now? And that's what we just need to, that's where we need to focus our efforts. And you had really great leadership, right? Like both hospital systems coming together, both the CEOs of like, okay, we're going to do this. Like, that was like a monumental moment of having
team.
Like Beth and Stephanie on a billboard together.
I know. Wasn't that awesome? When I interviewed both Beth and Stephanie, I was just like, this is awesome. Like you have two cross river, like on the surface, like rivals, like hospitals. And then like they were so collaborative, and they're such great human beings. And you talk to them, and like they're 100% genuine. Like this is not just like a public PR, like look at us and we're being collaborative. Like it was very much like we are in this for the betterment of people, and this is how we move forward, and this is what we're going to do.
Yeah. And that is so true, because they're just good humans in that way to know, like, because we all have common ground. And I think maybe that's what COVID taught us too, is like, guess what? We all have the same goal, and we all still have the same goal. So it's like, that's what we have to focus on. There's competition that exists. It's never going to go away, but we have to strip that back to say, what's the common good, and how does it benefit, right, all the organizations? And so we focused a lot when we first pulled Be Well Together was about, partnership and, like you said, collaboration. Like we've all been invited to tables, and you're like, I'm collaborating. Yeah. And you like use this of like, I'm working with this organization. Yeah. And they leave the meeting, and then nothing ever happens, right? Yeah. But you just keep meeting in this space.
And everybody knows that nothing is happening. Yes. And everybody knows that nothing is going to happen. And that's because the meeting isn't where the real collaboration happens.
Right.
Right?
Exactly. Yeah. Yeah. So I was like, no, this is about authentic collaboration. Like we have to find something to roll up our sleeves and actually do this. work, because we're all doing good work, like in the public health space, right? Like there's lots of maternal child health programs, and everybody's wanting to see infant mortality rates go down, and everyone's like, we're sick and tired of being the highest in the state, and our babies are dying, and we're saying like it's not okay. We're doing good stuff, but we just weren't doing it together, right? Like leveraging resources, being impactful, speaking with one voice. And like, we know there's benefits to all those things. And I was like, we have to do this. We have to do it. And so it took a lot. I mean, it probably took well over a year to sort of build that ground level framework based on trust to get us to where we are today, which is things like, less babies dying of unsafe sleep because of ABCs of back to sleep.
Yay.
And, RX kids. Like, it's amazing.
Yay. I was going to say something very profound, but I forgot about it. It wasn't that profound. So talk to me about, as long as we're talking about Be Well, give me the 101. So obviously hospitals are involved. Like who's all the partners involved in Be Well? Yeah,
so there's a lot of just partnership across. And that's what we say. Like, if you're doing anything in the public health space, you're trying to, you teaching a class on, I don't know, health and wellness, or you're a provider, or you're a community health worker trying to get somebody food resources. Like, you're all public health system partners, and you're all a part of Be Well. And that's the intentional design. And a little bit of that, like the health department sort of led Be Well, but that's been my thing from the beginning, is like, it's not a health department initiative. And some of our close partners that sit on the board were like, well, it's a health department. No, it's not a health department thing. This is a community thing. This is a Saginaw thing. And it took a little while to pull that out, right? Like, Be Well is its own thing. So anybody can use the logo, be a partner. And so there's a lot of organizations involved in that, like boots on the ground type stuff, right? Whether it's sitting at a work group or it's doing things. But there's an advisory board of partners that said, we're going to sign on the dotted line. We're going to help fund and commit to this because it's really driven by our community health assessment. So we do a community health assessment every 3 years, where we go out and we survey the community, we talk to partners, we talk to legislators, we talk to go around and have town halls and fireside chats and things like that with our community to collect feedback on what's important to you, where do you think our health is, and then we look at all the data, right? So we look at all the secondary outcome data too, and we pull all that together and say, all right, what bubbles up to the surface? What can we tackle? That gives us a direction, right? So that's really just the framework to say, here's our strategic plan as a community around health. So we do that. And those partners help fund that process. And so the hospital system partners, and then organizations like SVSU and the ISD and United Way and the Community Foundation, CMU Medical Education Partners, and of course, yes, Covenant and My Michigan and Health Source Saginaw. And there's a group of 12 of us that really fund that. And that's the board that says, yeah, we're going to roll up our sleeves. We're going to put resources behind this work. And we're going to each our small contributions to this. And so, yeah.
I love that. I mean, in Saginaw, community with that needs all of the resources it can have. Like we're a resource strapped community with serious health needs. And how everybody loses is if all the health influential partners say, well, we're going to play in this playground over here and over here and over here and over here. Having an advisory board of 12 different organizations all saying, what do we have to address and how are we going to do it? And then also, like you said, signing on the dotted line with hard action. Like it's not we just come together every quarter to talk about how we need to save more babies. Like, we're actually going to take steps to do that. And you see the billboards all over the place. Yeah. Like the safe sleeping. Like every time I drive down Michigan or Washington or whatever, it's ABCs. I see it.
I know. And that was a small thing. And that was CMU. CMU said, okay, we feel like we got to do something. Yeah. We're in the mom and baby space. And as CMU Health, Dr. Sheehan was like, I have the resources. And so we're going to put something together. And he went to Covenant. He came to the health department and it was like, yeah, this is a Be Well. This is a Be Well thing. And we all need to speak with one voice. And so we got funding across multiple organizations and everybody said, okay, we're going to have one safe sleep message. It's going to be the ABCs of safe sleep. And at first you're like, okay, just because we do, you know, some flyers and some billboards doesn't mean we're going to like, are we really going to be impactful? But we were like, no, collectively, right? We're going to put it everywhere where we can think of, on the buses and on, you know, banners hanging from buildings and things like that. And the saturation has been enough that like, yeah, like we went from 10 unsafe sleep deaths in 2024 to 2 in 2025.
What? Wow. Dang.
Right? It's impressive.
That is impressive. It's impressive. I think there's also a lesson here in that if you want to affect change, you have to have the scale of effort necessary to create that change. And so if you're one person running around, one organization running around trying to save the world or do something, like you can't do it by yourself because for this reason, you don't have enough resources. You don't have the megaphone of 12 different organizations all saying the same thing as opposed to just one.
Yeah.
And so I think that like there's a great lesson there. Like if you are on a mission and you want to do something great, especially when it's local and community, like you got to have more than just you at that table. Like you got to have help. You got to have people saying, I can fund that, or I can do the marketing for that, or I can develop the communication for that, or whatever it is, like community.
Yeah. And it doesn't have to be, I think originally we were all thinking in our minds in order to have like collective impact, right? Is what you're saying. Like it's saying, because everybody was doing, you know, I mean, Covenant has always had, you got to watch you got to watch a video, right? Before mom leaves.
I
on
watched
safe
that
sleep.
video.
Yeah, exactly.
I think there's like 2 or 3 of them.
Yes,
yeah.
There's Shaken Baby, there's Safe Sleep, and so like they're doing all of that, and they have been doing all of that, and we have home visiting programs. There's 7 across multiple organizations in this community, all working with moms to do and so it's been there, but we haven't had the collective impact and that speaking with one voice. And before this, I think we would have said, oh my gosh, this is going to take so much money. It's going to take so much money. And honestly, Dr. Sheen was like, I have $25,000. And so he was like, who else has $25,000? And so like, it was like a couple organizations that popped in like $25,000 to create this message in a campaign. And then when we did it, it was like really? Like that really wasn't that much money.
Yeah.
I mean, it might seem like it, but in the effort of what we thought in order to go from 10 to 2 in 1 year, like really that's like pennies, you know, and the return on investment of that. Oh gosh. I mean, more babies are alive today.
Yay. I love that. Speaking of babies.
Yeah.
RX Kids, welcome to City of Saginaw. Woo woo! So it's been really all over social media, RX Kids, and City of Saginaw put out some posts describing it. You guys presented in front of the city council. Tell me, what is RX Kids?
RX Kids is a cash assistance programs for moms and families. It is really intended to give empowerment for families to do what they need to do, which is take care of themselves and their babies. And so it was interesting. I was just doing another podcast earlier today, actually.
Yay.
And it was like, when I heard RX Kids, I thought you're giving like, is this like script assistance for children? And I was like, oh yeah, no, absolutely not.
Yeah.
No. So this is like a one-time cash stipend of $1,500 for every pregnant woman who lives in the City of Saginaw, in Bridgeport and Buena Vista Township. So there's 3 communities in Saginaw, to spend what she needs to take care of herself prenatally. There's no strings attached. It's not based on income. It's not based on insurance. It's just about where you live, right? So you have to live in the city or Buena Vista or Bridgeport. It has to be one of those 3. And you can get this if you're at least 16 weeks pregnant and you can apply to RX Kids, you get that payment. And then when the baby's born, you can get $500 a month for the first 6 months of your child's life.
Wild. wild. There's so many things I love about this. I want to talk about like the fact that there are no strings attached, in that like you're not dictating what people's needs are. You know, like, and so many programs, even if they're well-intentioned, would walk into this and say, well, we've got $1,500 to help pregnant moms, but you can only spend it on XYZ, and you know that mom is looking at like, oh, man, this could really help me get through the next 2 or 3 months of rent that I desperately need, but I can't use it on that. I need to buy $1,500 worth of baby formula. Like, I don't need that right now. I need rent.
Yeah,
and
I need to stay in my house so I have a place for my baby to live.
And what this program really acknowledges is that, like, it's holistic in the fact, like, if we take care of mom in whatever needs mom has, that's going to help baby. And for the program to come in and like dictate it, like that's the wrong approach. So mom, we're going to take care of you. Here's money that you can use however you want. Like I think in the city council presentation, you said like it's based on trust. Like we trust moms to meet the needs that they have. And so we're going to give them the money, and it's going to work. And I love it.
Exactly. And it is so, I know. And well, hey, I'm a government, like I'm the government, I'm here to help. As a health department, right? I'm a county governmental employee. It's like governmental public health. So I totally get it. Like I have programs, like WIC. Okay, I give you WIC benefits, but you have to buy these things. And it gets so granular of like, you have to buy this bread and not this bread because of all of the requirements that we just have to put into these programs. So like, I get it. I operate in those constraints and see our own clients going through those things. And it's funny because it's just a shift in how we think about how we solve some of those problems around assistance, right? As Dr. Mona would say, it's like reimagining the social contract. Because I think if we all strip it back and go, does every mom want to take care of her baby? Yeah. Does every person want to take care of themselves? Like, yes. But we have to have the means to do that. And we have to have the bandwidth to be able to do that. So it's like we know the conditions in which a lot of our moms and families are operating. It's tough. And so we don't need to further put these constraints on them. It's like we always talk about access, right? Which access to like care means a lot of different things for different people. If it's, hey, I couldn't get there in transportation, I had an access issue. Or you don't take my insurance, that's an access issue. So access means a lot of different things to a lot of different people. But we put programs out there and then we build in barriers so people can't access them. Yep. And it's like, we need to break down that. We need to think about how we solve some of our problems. And that's why I love RX Kids, because this is truly transformative in thinking about getting to root causes, which poverty is many of them, and trusting people and empowering. And that's what we're seeing out of, Flint's been running RX Kids for 2 years, and the outcomes of what we're seeing, like moms have the bandwidth to be able to do things that they never been able to do before. And so they're seeing even engagement, like when we always talk about community engagement, right? Like you want to engage the community as much as possible. And some people they don't have the bandwidth for it because I can't get to that space. And this program is allowing them to do that. So they're seeing things like an increase in voter turnout, an increase in WIC enrollment, an increase in other programs and services because they actually can get there.
Yeah.
You know what I mean?
Yeah. And the fact that it's a $1,500 cash payment, and it's like a direct deposit or in the form of like a gift card. Is that how it comes?
Yep.
Okay.
Mom can elect that during the application process.
Okay.
So if you want a direct deposit into your checking savings account, you can put the information in.
Wild.
But if you're not comfortable with that for whatever reason, you can elect like a prepaid gift card that they would come and pick up at the health department.
I mean, right there, like it you see the philosophy of access. Like, if do you want, there's no paper check, there's you have to go through here and you have to meet with an advisor who will qualify you over the course of 4 weeks. It's like you sign up, and if you're in the zip code and you're 16 weeks or more pregnant, You can say, I want it directly in my bank. And if you don't have a bank or you don't feel comfortable, you can get it in the form of a gift card. Like you see, like we have this thing that can help you and we want you to have it. We're not trying to like
have it.
build gates around it so that we can say we have this really great program that nobody can participate in.
Right. We want you to have it and we want you to use it for what you need.
Yes.
For what you need.
And then it continues, which is the part I really, really love. It says, we will help you before your baby is born. And then, like, speaking from experience with my 3 kids, like those first 6 months, like you're in a daze, you're so tired. Like, all you want is somebody somewhere to help you with the one thing. Just please help me with one thing, make one thing easier. And then here comes our ex-kid saying, we will give you $500 every single month for the first 6 months.
Isn't it amazing?
Amazing. It's amazing.
Yes. And it's that is based on science too. So it's not just like a frivolous, like, let's just give money away. Because obviously that makes people feel very uncomfortable.
Yeah.
Like the fact that you're saying like, there's no strings attached. I don't have to, you're not forcing me, makes some people like go, oh my gosh, really? We're just giving away money? What's happening here? And this idea, it's because that's inherently where I guess maybe our brains want to go. But we all know, like, as parents, like, the time when your child is born, like, there's usually a loss of income. I mean,
it's true.
You experience it, time off of work. I mean, most people, I never had like 100% paid while you want to stay home with your baby.
Yep.
Usually doesn't exist. I think we're getting closer to some of those things, but not really. And then increased expenses. And so like the science behind it shows that it takes people at least usually 12 months to get back up to income levels after the birth of a child, at least 12. And then when you have probably double twins and triplets and others, it probably takes longer, right?
Yeah, still not there.
Yeah, exactly. So, and those things are like, that's real. And so they literally studied that over time because they were like, well, what time of this intervention is important? So they figured that out. Also, the neurodevelopment. I mean, a baby's brain doubles in size in the first year. So we know how critical of a time that is. So when you've got stressful conditions of moms and babies, we do things like, because we all do, like, it's like the unsafe sleep message. You know, you talk to any parent and you start to talk about, you're like, okay, you know, y'all did it once or twice.
Baby fell asleep on me on the couch. Yes.
I mean, you're exhausted. There's so many things playing into that.
I haven't slept in 14 days. Yeah.
Like zero sleep at all because one sleeps, one's up, right? Like, so all of those, that's important time.
Yeah.
And so if we can start off on the right foot, if we can give families that extra breathing room, if mom doesn't have to, like, literally, am I buying formula today or diapers, or am I paying my electric bill? I mean, like, and that's real situations. And like, and that's why we're targeting the communities that we are, because the moms and families live in, like, this is real everyday challenges. And that's why, you know, because that's the other question I had, is like, why not everywhere? And so, I mean, the goal is everywhere for sure. But we've got to focus on efforts where it's like the greatest impact right now.
Yeah, I was thinking about that scale of impact too, because it would be easy to look at payments like this and say, well, this is the icing on the cake for, you know, when they want to go, like, you know, it'd be easy to minimize it.
Yeah.
But serving the folks that this is going to serve, I mean, that $500 could be life-changing in these situations. Like thinking about, we were talking about the neurodevelopment. It was the part that really connected with me, thinking about after our kids were born. You go through the first couple of weeks or so, and then you start to really you start to become more aware of the world and say, I've got to go back to work. Like, we need money and I've got to go back to work.
Right.
And so now you're starting to almost like rush back to work at this, like you said, most important time of the baby's life. And so having assistance like this during that time, I mean, like, look at the benefits that stack up. Mom or dad don't have to rush back to work, or they work less and spend more time with the baby. They're happier, they're healthier, the baby is happier, the baby is healthier. I mean, that's generational effect that you're talking about, as
Right.
opposed to being like, yep, baby's 3 weeks old, like we've got to go back to work, otherwise we're not going to make rent. And now you could be in a worse situation. So I just like the scale of impact of this is huge.
Yeah, it is. And I think we're going to see that. Like we're seeing such amazing immediate impacts of this. Like I said, like studying Flint and what they've been, it's astronomical, from the idea that, here's one of them when we talk about, so mom's got to prove that she's pregnant, right? So there is some documentation that moms have to, they have to upload. You have to prove that you live in the city. It has to be a physical address. The company that they apply through, which is called GiveDirectly, they're a company that does global assistance payments, like worldwide, and so they like have an infrastructure for this.
I love that you're pointing that out, because when I made the post on the City of Saginaw government page, that was one of the questions, like how are you vetting this, or is it just 20,000 people all saying like we need that check? Like, no, we're trying to serve pregnant women, mothers, so that's what you got to prove.
Right. You got to prove it. So you got to prove that you live in that geography. And so one is whether it's your driver's license or it's a utility bill with your name on it. There's certain required documentation that you have to upload. So you upload that. If you're pregnant, you have to prove you're pregnant. This isn't as we said, you can't take a selfie with your pregnancy stick and be like, okay, I'm pregnant.
Hey, Phil, give me my check.
So
I'd love if this was retroactive, man.
I know, right? Yeah. So you got to prove that, and so it's through an ultrasound or an after visit summary. Yeah. And so this incentivizes our moms to get into care. True. So we statistically, again, as we look at outcomes, far too many moms like late entry into prenatal care or no prenatal care. I mean, there are babies being born over at Covenant. They're showing up and they've never had prenatal care before. And so we know that there is a direct correlation between prenatal care and better health outcomes, right? That exists. So moms are going to get in. They're going to get in a little earlier, hopefully. Because the earlier entry, the better. And so then they can upload that ultrasound that's got, their name and their week's gestation and all of those things to prove that. And that GiveDirectly company does all of that. And so that's a great thing about the ability to do that and the extra benefits that we're seeing. So now in Flint, we're seeing, guess what? Better first trimester prenatal care outcomes. Awesome. Better birth outcomes. So we're seeing moms deliver at greater gestational age, right? So less preterm births, which leads to increased birth weights. And those are all huge indicators when we look at infant mortality. Low birth weight, very low birth rate, preterm births, number one causes of infant deaths. Wild.
There's so much talk in community health, in that community health is directly tied to poverty, financial burdens, and things like that. And the thing that I love about this program is that it directly acknowledges that. It says, if you are struggling financially, your health is going to be less, the health of your children is going to be less, and so we're going to help you address that problem directly. Like you can. And it is important, like financial literacy and all of those things, like very important. But when rubber meets the road, you gotta have more coming in, or enough money coming in, or a box to check. Like I know I can afford formula this month because of that, and it directly says this is a problem, and we're gonna meet this problem. I'm immediately thinking of so many like community groups that could just be so instrumental in like knocking on doors and saying here's how you sign up for RX Kids. You might be pregnant now, you might be pregnant in the future, and if you are, please apply to this program, because they're also thinking like, how do we address poverty in Saginaw? How do we address health in Saginaw? And their boots on the ground, like, man, this is awesome. Where does the money come from?
So, good question. It's been a multitude of things, and so. How it all started with Dr. Mona, she has been advocating since the beginning of like state level funding. So some people are familiar with TANF, which is Temporary Assistance for Needy Family Funding, and that's at the state level. So as they started to talk to legislators and got some good support, it was like, where can we pull funding from? Again, originally to pilot it in Flint.
Yeah.
Where can we get dollars from? And so she got early on temporary assistance for needy family funding, which really had to be, again, all the government bureaucracy directed towards, Medicaid births, right? So we know that those moms on Medicaid who are delivering, again, looking at the city of Flint, we can direct some of those dollars there. But Mona was smart in saying, we need this like targeted universalism. This isn't about income. Shouldn't be about insurance. Like at the end of the day, every person could use this, right?
Yeah, I'm thinking like Alice population too, that are
the donut hole, right?
Yeah, like the benefits cliff, and like, well, I make more than I can't qualify for that kind of assistance, so I'm in this purgatory of need. And so like this universal is like, well, we got to help those people.
Correct.
Too.
We have to help everybody.
Yeah.
Because, place matters, right? So when you start to live in communities, like literally where your place that you live can predict how long you'll live.
Yeah, the zip code.
Yeah. That's like, it's remarkable findings. And so she said, we're going to target universalism on that. And then she was like, all right, we're going to go out and get dollars. And so she got philanthropic support. And they were like, okay, let's look at the numbers in the city of Flint. What do we need? How do we go out and raise money for it? So she did. So that's how they launched in Flint. And so from that time period, again, she had good legislative support. So it was like, okay, what are other target communities in Saginaw or in Michigan? Of course, Saginaw was on the list for various reasons. Yeah. And so she came to us, and this was like, I don't know, maybe 4 or 5 months into RX Kids. And so we hadn't seen any outcome data yet, but she came and came to Saginaw, talked about the program, and was like, we want you guys to do this. We want you guys to be, your neighbors of your high need community, your neighbors of Flint. And so we were like, okay, like this makes sense. Be Well Partners, to support this initiative. And so when she starts going down the evaluation of the program and the things we're going to see and all this stuff, it was like, we all got excited because again, collective impact, right? So we've kind of been behind the scenes, like raising money, and going to various groups. And of course, we would tell Mona, like, there aren't the deep pockets like in Flint of, like from the Flint water crisis and the, big foundations like Mott and things like that. Right. So we're a smaller community. And so we don't have like that deep of pockets, but there are pockets out there. And so let's just start to go after them. So that's what we started doing. But Mona's been continuing to advocate. Like I said, her goal is every baby born in the state of Michigan, like every pregnant mama, every baby. That's the goal. And so I think as of today, we're like, 26 or 28 communities across Michigan. Yeah. So like we're on our way for sure. And so, but it's definitely a public-private partnership on the funding side. So not only do we have TANF dollars dedicated, but also through her advocacy and her team, general fund dollars. And so the awesome thing about this is that there's good bipartisan support. Yeah. And so this year in fiscal year 26, with all the craziness going on with all the budgets, the federal and the state level, they approved $250 million of general fund in the state of Michigan to expand RX Kids.
Yay for babies.
Yeah. Yay for babies. Right. And so Mona reached out and was like, all right, Saginaw, where are you at? And we were like, okay. And we had raised about, I don't know, I'll just say like 750,000, I think, or so. Wow. Yeah. So like,
way to go, Saginaw.
I know,
dang.
Right?
Yeah.
Like, and we've had some amazing partnerships. And so like the Community Foundation is our local fiduciary. So all the funds through Philanthropic are being collected at this Saginaw Community Foundation. There's a donor advised fund there that was like, yes, we want to help support this. So they gave a large donation. And then, actually, our friends at the TriStar Trust Foundation, like, amazing. Talking to them, Jack and Kristen, it was like, they're like, wow, we get it. Like, we get the transformation. We get this addresses root causes. We get what this program is going to do. So we've had support from them. And honestly, like, other private donors through connections of like realizing like this is a smart thing to do. Yeah. And so everything from like $500 to $500,000, like we've had everything in between. Wow. And so it's been amazing. Brilliant. We still need to raise about $400,000 because the dollars that the state has secured is for 3 years. So we're running this program for 26, 27, 28. And so we've got that it costs us, the philanthropic support, about $400,000 each year. So we've got to raise about $400,000 to get us to the 3 years.
Awesome.
Yeah.
Awesome. I'm so happy. I'm so happy that this program is here. Now it just becomes getting the word out and making sure people take advantage of this. So if people are listening to this or if they're watching this and they say, I know 5 people right now that could benefit or I could benefit, where do they go to apply?
rxkids.org.
rxkids.org. Have proof of pregnancy ready, proof of residency ready, and then you're good?
Yes, as a pregnant. And then if, obviously, birth certificates, right?
Yeah.
So if it's a child. So good thing about it, so you have to be pregnant at least 16 weeks. So if mom finds out she's pregnant 8 weeks, you could apply, but you have to go back in. It has to be like at least 16 weeks, right? Which is about the time usually ultrasounds and stuff happen.
That's true.
And so once they're there, then they can go in, apply with those 2 pieces. It literally, we have a home visiting program, nurse-family partnership. So one of the moms that came and talked at our press conference was a City of Saginaw mom, like soon to be expectant. And in case we were like, okay, as soon as January 12th hits, we need you to apply because you have to be pregnant. So if you wait until after the baby's born, you don't get that $1,500. You have to be pregnant at the time you fill out the application. But our moms if you have the proper documentation, probably takes you 10 minutes to do it. We've already gotten feedback from moms that in less than a week they were approved. And
this
so I'm
is
waiting.
The quickest money that you're gonna make ever.
I know. So I'm waiting to hear like how from that approval to when it gets deposited. That part I don't know about yet, but it's been it's moving along. And then once the baby's born, right, they go back in, they apply, they birth cert, right? Yeah. And then the $500 a month.
Wild. Well, Chris Harrington, I want to thank you for your work at the health department. I want to thank all the Be Well folks for obviously this program, but all of the stuff that you do. There's such an important asset for the city of Saginaw. I don't use the word transformational lightly, but this is one. Like this is one. Like when we're thinking and kids and the future of kids, such an important part of the culture of Saginaw. Like Saginaw, we love our kids, and like we're trying to build a better future for the kids. And this is one of those programs that every single person who this is available to, like you have to take advantage of this. So rxkids.org is where you go.
Yes.
Awesome. Chris Harrington, thank you so much.
Thanks, Phil. Appreciate it.
You're awesome.
That's awesome. Thank you.
I'm Team RX Kids all the way.
Yeah, I know. It's exciting, isn't it? It literally is. Like